As David said, my name is Mike Falatko. I'm the CEO of House Hospital in Cass City, which is in the center of the thumb, very rural area. About a week ago today, I had to inform 23 of my employees at the hospital that we were laying them off. The reason we laid them off basically is because of totally inadequate funding for Medicaid. To give you an idea of how that has affected my hospital over the past few years, in 2008, Medicaid beneficiaries represented about 12.8% of our business. It cost us $2.65 million to take care of them that year. That was our cost. Medicaid paid us $880,000 to do that care. We lost $1.7 million on Medicaid. At the same time, we lost $850,000 on our operating business for that year. In 2009, that percentage of Medicaid beneficiaries increased to 14.1%. It cost us $2.85 million to take care of them. We were paid $736,000. We lost $2.1 million. We lost $1.3 million as an operating loss that year. This year, that has increased to 16.8%. We took an 8% cut, which was done by the Senate, on our payments, and that has been moved into fiscal year 2011. So I anticipate our loss this year on Medicaid business will be about $2.6 million. We're a small hospital. We are a critical access hospital. We've been designated by the state and federal governments as a hospital that's critical to access in rural areas. We're small. We're about a $19 million operation. The trajectory that we're on with the losses on Medicaid are absolutely unsustainable. As I noted, basically we didn't lay these people off because of volumes or productivity or anything like that. It was basically because we had to find some way to make up the money that we lost. And basically the big loss was on Medicaid. As a critical access hospital, we're paid cost-based reimbursement by Medicare and Blue Cross. So it covers our costs plus a little bit on top of it. This also drives the rates that we charge our commercial payers. To give you an idea how strange our situation is, it's almost surrealistic. In 2004, the Joint Commission came into our hospital surveying us for Medicare and basically said we were deficient in several areas, basically our electrical and heating and cooling systems, and we had to do a major renovation. In order to do that, we had to apply to state for a CON, because if we didn't do it, we would not be able to participate in the Medicare program, and that wouldn't allow us to participate with Blue Cross, which would put us out of business. The state gave us a CON. We proceeded to move forward, but part of the deal with the CON is you have to participate with Medicaid. Now we find, after all the renovation and everything, that Medicaid's payments are basically putting us out of business. I just cannot emphasize enough that Medicaid funding has consequences, and the decisions on how we fund hospitals has consequences. The Medicaid funding formula for our hospital as a critical access hospital it's just cost 23 people their jobs. These are good paying jobs with benefits, and they are jobs in an area that are hard to come by in a rural area like ours. The way you pay us now just isn't workable, simply because as Medicaid displaces our cost-based reimbursement, we go from getting an average of 110% of our costs from a combination of Medicare, commercials, and Blues to 25% of our costs from Medicaid. So we lose on every Medicaid patient we see. So the more we see, the more we lose. It's not like we make it up on volume. I think the formula for Medicaid in the small and rural hospitals and in the critical access hospitals. Critical access hospitals are 25 beds or less. It's a special designation from the federal government. And the small and rurals are 26 to 50 beds. We're basically small hospitals. We represent about 40% of the hospitals in the state, 55 of those. I think it needs to change to basically a cost-based formula to be consistent with how we're paid with the others. I think that's the only way that smaller rural hospitals and critical access hospitals are going to survive into the future. You can do this, and I know money's tight, but we could do this and take care of all of this with all 55 hospitals for about $16 million. That $16 million, based on the fact that we get matching funds from the federal government, would generate an additional $45 million in matching funds from the federal government, which would go a long way to taking care of a lot of needs at the hospitals and within the Medicaid program. From that standpoint, I think you need to understand that funding decisions do have consequences. At a recent board meeting, we sat and went through this because it's such a huge hit on our hospital. And my board looked at it and basically said Medicaid right now is representing about 17% of our business. It is in jeopardy of putting us out of business. That would put all those services out of business and unavailable to the other 83% of the people we serve. And our mission is to serve all of our citizens. And also to keep the major employer in our region open. And the board looked at it and said, you know, basically if we cannot find some way to get the funding corrected and more in line with how we're paid as critical access hospitals under the other programs, if push came to shove, we would really have to stop seeing the 17% to preserve the 83%. I mean, I'm not saying that as a threat. That's just a reality that we're facing, simply because there is no way to make up a $2.6 million loss in Medicaid in a hospital our size. It just isn't going to work. So you have all of the written testimony in a lot more detail. I appreciate the opportunity to present this to you, and I would be happy to answer any questions you